The rise of long COVID, a condition characterized by persistent symptoms long after the initial infection, raising important questions about the role of government, personal responsibility, as well as healthcare policy. Joining us now to discuss, internist of Custom Care Medical, Dr. Frank Contachessa. Thank you, doctor, for joining us.
Great to be here, Lydia.
A lot of people don't realize what is long COVID. You know, I know there's a variety of symptoms, and yet they go to the doctor, the tests show that they're fine, but they're not feeling fine. They're still having difficulty breathing. So what are some of the symptoms?
Sure, Lydia. You know, this is a sort of a vague constellation of symptoms. You can see fatigue, you can see brain fog, you can see persistent shortness of breath with exertion. They walk up a flight of steps, they get out of breath. It's sort of a vague constellation because there's no specific test for it. And it's also hard to parse out, did these people have the symptoms? Because everybody's had COVID now. You know, the vast majority of people at some point have had COVID. Also, the vast majority of people have had some form of the vaccine, the mRNA vaccines. So there are some theories that it could be from the persistent mRNA from the vaccines that could be leading to long COVID too. So it's very difficult to parse out. It's difficult to diagnose, and there really isn't any treatment, so that makes it even harder.
It really does make it more difficult because doctors, they didn't understand COVID to begin with, right? Everybody was screaming ventilators, ventilators. And then we found out that's the worst thing you can do for someone is if has the COVID infection is to put them on the ventilator. So how do you even treat something like this? I know there are some facilities here in New York that have like programs for people with long haul COVID. But by and large, I've been hearing that people are suffering from it. My friend's wife, she thinks that she has it, and the doctors don't seem to be able to help her.
Really, it's treating on a symptomatic basis. So if somebody, I've had somebody who had really serious fatigue and brain fog to the point where they couldn't even they were starting a new job. They couldn't even focus long enough to start this new job. So you go to something like maybe try something like Ritalin or Adderall because the symptoms look like an ADHD kind of a difficulty focusing, and it did help. There's no standard protocol for this, so this is kind of where the imagination and creativity of the doctor comes in. If someone's short of breath, you treat them with respiratory medications. So it's really symptom by symptom. There is no treatment for the overarching syndrome of long COVID.
Before I let you go, we're hearing more and more about young people getting cancer. You know, some people think it's the stuff in our food. Are you seeing that in your practice as well? More and more younger people having conditions that we normally saw in older people? We have about a minute left.
Yeah, I think we'll be seeing this across the country. You know, they're lowering the age to get a colonoscopy. It was 50, now it was 45. There's talk of going to 40. We do see these things, and I think it's a multifactorial thing. I think the toxins in our food, in our environment, are a big part of it. There's talk of things that attack the immune system. I think that we might find at some point that the long-term effects of the COVID vaccine might bring us down that road too. I'm halting because it's a controversial topic, and it's hard to get these things out. But I think it's worth looking into. But you do see these things. But definitely getting the toxins out of the foods and cleaning up our diets and exercise and improving our lifestyles. That is always going to be an improvement in people's overall health and reducing risk for cancer.
I was also reading on the overuse of antibiotics. It messes up the microbiome in a person's stomach. They should be taking probiotics. So like you said, it's a multifaceted reasons. But of course, health is wealth. So the most important thing, you got to take care of yourself. Dr. Frank Contachessa, as always, thank you so much for joining us.
Thanks, Lydia.
Still to